Welcome, everyone. We'll be getting started shortly. Welcome in. Thank you for being here. We're going to get started here in a few moments. All right, let's go ahead and get started. Welcome again to From Frustration to Impact, Tools for Families and Educators to Drive Change. We are so glad that you're here. I am your I am your moderator, Camilla Antoine. I'm an implementation specialist with Harmony, and I'm thrilled to really moderate today's webinar brought to you by Harmony Academy at National University. We host these webinars to really bring thought leaders together and educators to share best practices and tools to support social and emotional and academic learning. These presentations are the opinions and the content of our guest speakers and may not necessarily reflect or be a direct representation of Harmony. All registrants will receive a copy of the recording so that you can watch and share with your colleagues, so that you just be on the lookout for that email, and feel free to share comments and wonderings or ask questions in the Q&A box, and we'll certainly try to get to those. So a couple of objectives for our time together today. We are going to learn science-based strategies to support community well-being and relationships. We're going to discover tips on how families can confidently express their concerns within the education system. And we're also going to build some self-awareness and positive mindsets to impact learning environments with the support from Harmony tools. So we're going to launch a poll. Amanda, go ahead and launch it. We want to hear from you. Your feedback is really valuable. And our poll question reads, what is most important to you? And when you think of education excellence for every child in our schools across the nation. You see those responses coming through. I love it. I love to see it in real time. Give it a few more seconds. All right. All right. So it looks like we had a resounding all of the above when it comes to the most important thing when you think of education excellence. Highly qualified teachers in every classroom, healthy learning environments for all, a range of opportunities for students to excel, supports provided for all learners. We, I think, all overwhelmingly believe that all of the above have a place, but it's also interesting to see that range of opportunities for students to excel and supports provided for all learners were kind of neck and neck for that second place spot. So thank you for engaging in that poll with us and giving us that feedback on where you stand as it relates to what's important. So I have the honor and the privilege of introducing our guest author today. I'm so excited for this conversation. And we both jokingly said how we like to kind of come unprepared or prepared, but not really, practiced or rehearsed. So it should feel like an authentic conversation. Christina Cipriano, Ph.D., she is an associate professor of applied developmental and educational psychology at the Yale Child Study Center and Director of Education for Collaboratory at Yale University, and an author of a forthcoming book that we're going to be super excited to hear about today, Be Unapologetically Impatient, the mindsets required to change the way we do things. Thank you so much, Dr. Cipriano, for being on our call today.
Thank you so much for having me, and thanks for all the love coming out of the chat right now. I can't see the
Yes,
people,
you
but I
are
just see the
blowing up our
notifications, so
chat
thank
right
you for that.
now. I love that. I love that. So I want to get to hear a little more from you, but before we do that, in Harmony, we always start things with a quick connection. This is a strategy that we use with students, adults, anybody in the community, and it's to get to know you a little bit better. So it can be used for students, but it can also be used for the adults. And so we get to share one of the quick connection cards. And so the question that we have for you today is, what person from your own life is your hero or role model, and why? And how has this person positively impacted your life?
Oh my goodness. Well, I mean, we have an hour together, so I could gush forever, but easy question. My dad, my father,
Aw.
Salvatore Cipriano, his namesake of my son. My dad, he is the wisest man that I know. He is endlessly compassionate. He was the oldest in his family. He only had the opportunity to go to school until the eighth grade. And then, due to the death of his father, he dropped out of school and worked to support his mom and his younger brother at a time when, we're talking about like the 1960s here. Like this is a time when opportunities were not many, and anyway.
Right.
So he raised me and my three siblings to be always very grateful and to always engage and invest in our school. Like he kept always saying to us early on, you don't want to be like us when I grew up and have to like work every job you can. Like I want you to be happy. In order to be happy, you have to stay in school. And so he just instilled in us this tremendous work ethic. I mean, I had jobs. I always had multiple jobs. I don't remember a time when I wasn't always doing something. I mean, babysitting to start off and then some.
Yes.
And we come from a family of big work ethic, and he's such a model of that. And he's, not been handed the easiest of cards over the years and over his life. And yet he approaches everything with such grace and compassion. He's always willing to listen and learn from other people. And his sense of humor brings the room down. So yeah, absolutely, hands down,
I
my
love
father.
that. Sounds like just a joy to be around, and what a foundation to get that work ethic. I can relate in so many ways. So thank you for being willing to share that. And
Absolutely.
yeah, and about your dad.
Thank you.
So we are here because we're super thrilled about your new book that's coming out, Be Unapologetically Impatient. And so our conversation today is going to really be around that content and really some of the inspiration that you had leading up to it. And so I'm again just really excited to hear more. So when it comes to writing this book, tell us a little bit about like, we're obviously, many of us in the audience are probably education professionals, but we also know that there may be someone here that's not, and that the book is really open to all industries. So give us some more context on how that comes together.
Absolutely. And before I kind of get into it, I just want to acknowledge it looks like there's a lot of people on the line right now, and you all have so many spaces and places to like choose how you spend your time. I'm just deeply grateful that you chose to spend your time here with me and here with us this afternoon. So thank you so much for doing that, especially for those of you who are in education and you're at the end of the semester, the end of the school year. I mean, there's so
Yes.
many things going on, testing, right? All the things. So anyway, and I'm calling as speaking to you all today from my little box in New Haven, sort of from my office here. So welcome to my home, my work office for those who've
Yes.
seen me speak before. But anyway, so the book. So My book, I wrote a book for everyone. And, when I was thinking about positioning the book, the goal was to write it for everyone. It's for educators and their students, for parents and their children, for doctors and their patients, industry executives and their clients. And in the book, I teach that being unapologetically impatient, which is the activation of intrinsic motivation, emotional intelligence, and gratitude, that this is the mindset required to change this idea of the way we do things. And so I do this by drawing on deeply relatable experiences that are embedded in everyday living across our lives. I anchor my storytelling in our family's journey, a very challenging journey to a diagnosis for our oldest son and his rare disease. And I apply all of the science that I've had the privilege of getting to learn over my life. So applied developmental psychology, educational psychology, social psychology, and the principles there within to provide every one of us with skills that will help you to change the way we do things right now.
So good. And like you said, so much of that is applicable and it transfers across multiple industries and spaces and places.
Yeah, yeah.
So
And
good.
yeah, it's my goal is to be interdisciplinary. And so
Awesome.
all my sciences and the book certainly is.
So you mentioned a little bit about the journey with your son, your own personal journey.
Mhm.
Was that what inspired you, or kind of give us some more background if you're willing to share that?
Yeah, yeah. So absolutely. I mean, my son is an inspiration. And the reality is that I had been thinking about writing this book, this topic for a really long time. And I kept thinking that like someday I'm going to be eligible for sabbatical and then I'm going to write that book. And for those who've ever taken a class with me before, I would use some content. I wouldn't call it the book content. But I was thinking to myself, like some of these topics and ideas, like, working them into lectures for teachers and pre-service settings and so forth. And it was interesting because I kept thinking like I have to wait until I have the time to write the book, and then two like really formidable things happened. So the first was my middle. So I have four children: Miles, Salvatore, Eleanor, and Luciana. And Salvatore and Eleanor are we call them our middles. So they transitioned, as they're in elementary school, and they transitioned from asking like content questions about their world and trying to understand what's going on around them to much more like broader inquiries. And so they would ask me things like, why are the places that we're going not designed to accommodate their brother, my son Miles, and his wheelchair? Like, why is it not set up for us to be here? Sal asked me like why he had to hide for drills at school, like what was going on with that. And Eleanor asked me like how come I had taught her
Will it
that
be joined or here?
her disabilities are her superpowers when like she had a teacher who actually told her that disability is an illness. And so these questions, they really inspired me to like a new level of realization. And seemingly at the same time as I'm kind of having this moment with my middles, going through time of like, what am I waiting for? I have colleagues around me and they're saying to me like, Chris, why are you waiting to write the book until you're on sabbatical? Like you clearly thrive when you're busy. Like anyone
Right.
who knows me professionally knows that like I seemingly am better when I'm being an octopus than when I'm supposed to focus on one thing. So we could talk about that as a superpower. And so I was like, you know
Mhm.
what? You're right. So like I've been so we've been so patient, socialized to be patient. And so rather like it was time to do it like right now. And so, I said, what am I waiting for? And I committed. I looked at my husband. I said, I'm going to do it. I'm going to write the book this summer. I gave grand rounds at Yale, which was an honor last spring. And I announced that I was writing a book. And so then it became real. I started saying it
Yes.
and I wrote the book, and I wrote the book in like, I mean, the meat of it, 4 months. Like I've been
Wow.
thinking about it for so long that I finally
Yeah.
just said I'm going to give myself permission to take the time to sit down and write
Yeah.
it,
Yeah.
and I couldn't be
How
prouder.
powerful. I love that. I love the
Yeah,
thought of once I say it, right? And when you say that publicly in such a
put it
big
out.
platform,
Yeah,
there it is. Wow.
absolutely.
Okay. So when we think about like how can we share some ideas, because again I know our audience is diverse, and so everybody is looking for ways, right, and ideas maybe from the book that can support community well-being and healthy relationships when it comes to the classroom, because some of the things that you said were powerful about the experience of your middles.
Mhm.
and how they're even processing how this all works. And so, what are some of the things in the book or ideas or concepts that can support that community well-being and healthy relationships?
Yeah. So, one of so the book uses evidence-based practice, applied science, and storytelling. So I share lots of kind of deeply personal vignettes and experiences, and then those from kind of around us in life to kind of move through a series of framing of how we see the world, and then a set of strategies that come with census starters and what to say and how to say it to
Mhm.
begin to address change so that each person who reads the book would, ideally have this kind of toolbox of resources. Just like, you and I, if you work in school-based interventions or programs or teachers, medical providers, right? You want to know what to say and how to say it. And so, one idea, and it's many in the book, but one idea to just highlight is I break down this idea of the call in
Mhm.
forming relationships with others. And so the idea here is that the call out or like putting people on the defense is
Mhm.
pretty popular. You see it
Mhm.
on your socials, you see it on your local family, district Facebook group. You might see it at the board meetings that go viral.
Mhm.
And a lot of times that call out will get things done, but it doesn't build a relationship. And so when we think about wanting to build a relationship, and let me just use the example, I imagine there's a lot of parents and educators on the line. So if I can kind of speak to whom I think is here, you want to be able to invite somebody in to be your partner in how you're engaging in building relationship and like supporting your
Mhm.
kid. And so let me give you an example. So let's say that you're a parent and you've got a child who has a particular need. Maybe they just diagnosed with a learning disability. Maybe they're going through an IEP, 504 plan, or you're right. And you're a parent and you're going to speak to that teacher about it. And many times in the ways in which education and medicine have been intersected, we are often positioning each other as like opponents in the process rather than partners. And I will give all the educators and the adults in the room like benefit of the doubt here. It is not our fault. So like we all, as we age, we become more inward leading in our brains. And so what happens is like we start to create like scripts of how things are, and they start to minimize the level of detail with which we pick up on other people and how we see them. And so, very well-intentioned parent, myself and everyone else, we can go into that IEP meeting or go into that parent-teacher conference or go into that doctor's office, and they see a parent or that parent, right? Or we as educators, we will see others as a parent or that parent, or a student or that student. And it's not, it's some malicious intent driving it, but rather a like our brains are tricking us to like, oh, I know, oh, that's a child with ADHD. That's the mom of a child with ADHD. Like, I know what that's going to be like, right? Like we fill it in. And so anyway, the point of my story here is that we need to invite other people in because we need a partner and not an opponent. And when we create the conditions for putting somebody on the defense in what we say and how we say it, because we're like impassioned, like I am about my kids, and you may get angry or you get hot or you might say something,
Yeah.
right? Um, Nobody is listening to learn anymore. They're not listening to
Mhm.
help you. They're listening to win. And so you
Right.
create, like you position them, and I tell a series of stories in one chapter called "The Call-In" in the book, where kind of break this idea down further of how we can each work to kind of reduce the like acknowledge the hierarchy that's between the conversation that we're having, reduce it, and then invite each other in to problem solve together
Mhm.
because it's
Mhm.
actually easier if we were
Yeah.
to engage in it together. But it takes effort. It takes an intention and an attention, right? We
Mhm.
have to be very intentional with
I
what we
love
say,
that.
and we have to attend to how we are responding. And these are social emotional processes. These are skills and
Right.
strategies that can be learned, right? And so we
Yeah.
can we can each learn them and engage. So the
So
call in
good.
and helping to form those relationships between parents and providers, so educators, doctors, is one theme that I move through in the book, and providing folks, and it's both sides. I want to clarify. I was kind of framing that in terms of like what the parents might teachers might say or do, but it's also the parents too, right? So
Yeah.
like parents might be like, oh, it's that teacher, right? And so they've already
Right.
decided, like going, I
Right.
heard about that teacher, or like, the
Yeah.
who does your kid have and how to rate, or what I heard that they're not good with blah blah blah, all those things. And so how we can reduce that through what we say and how we say it, so that we're modeling like healthy inquiry and building supportive relationships.
So good. Something you mentioned about just giving folks language on how what to say, right? Those
Yeah.
stem sentence starters. Is that something that's like explicitly in the book, or do you? Oh, I love that.
Yeah, absolutely. So there, and I go through a whole different sets of skills throughout. So it really is this like activation of intrinsic motivation, emotional intelligence, and gratitude together that provide these
Oh yeah.
frames of what we say and how to say it. And it's derived from evidence-based practice and also practical experience. Because I will share with you in the book, like the moments when this went right, or what's what I said, and also like lots of moments when it went wrong, because those were
Right.
tremendous learning opportunities for me
Mhm.
as a professional who comes to this work with a particular vantage point on
Mhm.
what I see, what I'm seeing happening, with my kids and in my community, and in my family, as an opportunity for us to all grow through it. But I cannot stress enough how deeply important it is to have, the intention and attention, because
Yeah.
we, as all of us, all in our professions, we fall into it. We fall into scripts and patterns, and
Mhm.
it's something we can all work to actively amend as we engage.
Yeah. And so you mentioned in your experience just how you've kind of moved through it as a family and how you've
Mhm.
navigated some of those wins and some of those learning opportunities.
Yeah.
What would you share with other families, and giving them some tips on how they can confidently share their experiences from their vantage points within the educational system? Because when you're passionate, or like you said, it's your mama bear, it's your
Mhm.
baby, and you
Mhm.
want to go and express that. You want to be able to share that in a way that is productive and can be partnering with those, with
Mhm.
those school folks. What tips would you give to families?
Yeah. So, start with an introduction that removes the anonymity of who you are or who they might think you are, so that they begin to at least invite the opportunity for them to see you and see your child as they are, and not who you're imagining them or who they're imagining you to be. And so, we talk about the importance of building relationship. That person or that entity, that team, that group, right? They You need to put relationships first in order to be able to open up healthy dialogue, so that we can problem solve together. And
Mhm.
in the book, I provide, examples of the ways in which, well, I mean, let's just call it for what it is. It's called Be Unapologetically Impatient. I go into great depths of explaining why we should not be apologizing for our children, our needs, and our families. And
Mhm.
so, many of us in the instances of, advocating for children, be it with a educator, the education system, the healthcare system, um, may feel inclined to apologize, as though we're sorry that we're asking for
Mhm.
extra or something, right, along the way. And so I kind of break down all those pieces to then arrive at, well, what happens if you switch that frame from when you're about to say I'm sorry, start with thank you, right? And
Mm.
then what shifts when we lead with gratitude? So we introduce ourselves, we lead with gratitude, and then move into a statement of facts in what we say and how we say it,
Yes.
rather than the kind of other pieces there. And I'll tell you, if it's something that is deeply personal to you, oh, that's right. With something we got to hold there, right? So you might need to
Yeah.
have those notes. Maybe you practice
Mhm.
it with a partner or loved one first, but really a strong opportunity there to begin to affect change. And one other thing I want to note, and if you've heard me speak before, anyone who's on the line, I've said this before, and I will just say it again and again. We as adults, as parents and caregivers, as educators, healthcare professionals, we need to model this way of talking to one another in front of our young people, in front of our children. And so many times in education and healthcare, we step out of earshot of the kids, or we do it behind a closed door, and it's the secret quiet other thing. And you know, in the book I really explicate this idea of how you can model it, and what you say and how you say it, and think about that, you know, the way you want to be speaking with these people who are the partners in helping to grow and support your children and your family, should be a way of speaking that they can be there for, and we can be their teachers and model it.
Yeah, well, we're setting the blueprint, right, for our kids
Exactly.
on how to handle difficult or challenging conversations and things. And so when we model this, and when, like you said, we do this in front of our children, it is again just a blueprint for them to know and understand the best way to solve and resolve issues. It's so clear.
Yeah.
How can we keep this work moving forward without getting overwhelmed? Like you said, some of when you have that passion or you see something that is an injustice or something that's not right, it can be really draining. How do we keep ourselves from getting overwhelmed?
Yeah. Well, you know, first and foremost, systems change, any change, it's incremental. Nothing's going to happen overnight. It's not everything all at once. It's the small steps. And the book I talk about, you know, these are sometimes these kind of just the way things are, this frame of things that you're trying to address and change, you know, in the service of your child, yourself, your family. They could be just so big, right, that it feels like there's no way, there's nothing else. And, you know, honestly, it could take our lifetime to change how people like see us and to change the system. But you know, I teach in the book how each and every one of us can change how we see ourselves, like right now. And so you can choose something really small, right? You choose the grain size of where you're going to start. And I give examples of this throughout the book of kind of small, incremental steps. Because even that, you know, I'm calling it small, maybe it's a first conversation, feels huge, right? That's huge. I
Mhm.
did that first big thing. And so um, to be able to move ourselves forward and recognize that it's not all our responsibility, it's all of our opportunity to engage together. And so in the book, I talk about the ways in which, you know, when we recognize our opportunity and the privilege that comes with that opportunity to be able to say something, to support, to affect change for our child or you know, our children or others, that, you know, for some of us, it's an obligation to say, you know, did you know, or could you know, or can I show you, or let me share a bit more about it. Let me give you something like really like a concrete example on that to just like bring it together. So I could have admittedly written an entire book of examples of when we had things go wrong relative to Miles and his wheelchair in like systems and stuff. And if you've followed any of the popular writing I've done over the past decade, there have been lots of stories that I've shared of things like not going so right. And, you know, one story that comes to mind right now as I'm speaking with you is about how we were on our way back from a family vacation. We had my parents and my in-laws. We were super blessed. We get off the plane and we go to depart the plane, and his wheelchair does not arrive at gate check. And so it's like all of us and our like very busy little crew, like holding up our son. He requires like full support, right? And like in the little tiny jet bridge area, and like the whole plane is, you know, everyone's leaving. Patrons are
Mhm.
like saying horrible things about the airline. They're telling us they're sorry. They're like walking by. um, I learned that the flight attendants couldn't leave until we left. So we were basically
Mhm.
holding them hostage, right, in this little jet
Mhm.
bridge. And like we obviously couldn't leave until the wheelchair materialized, right? So like the
Right.
strollers come and go, the car seats, like, and we're just like waiting and waiting and waiting. And like, you know, they let my little girls back on the plane to use the bathroom. It was just this whole cluster. And
Well,
finally, like all these managers come, and like 45 minutes later, the wheelchair materializes. It apparently had been brought to luggage, you know, right? And it
the
comes
baggage
back, and we
claim.
get the wheelchair, and the manager is like, you should really complain to the airport. You know, he's like on behalf of the airline. You should complain to the airport. Like this is unacceptable. And I said, well, you should complain to the airport. on behalf of all families that this is unacceptable. And I proceeded to talk with the entirety of the flight staff that was there, who was still waiting for us because they couldn't leave until we left. And so I was like, I have my moment here, my opportunity to say,
Yeah.
you all just witnessed what you were very vocal about saying was an injustice, was something that should not have happened. And it
Right.
happened. And I am sure that I am not the first time that that has happened. Right. And
Yeah.
so why is it on me as the like client or patient in this place to fix the system? Rather, what can we do together? I'll call, but can you call? Can you call on behalf of all families? And,
Right.
what could happen if you do? And so
Right.
really practicing that model
Right.
of like, we're all, it makes everybody's life better if we do
For
this together.
sure, yeah.
Yeah,
And what power they have as employees of the airline, right? To
exactly.
drive and help move the needle. And when it comes to that, thank you for that concrete example. It really does bring it to life in understanding like we are collectively working toward the change that's necessary. So good. All right, so what was your why to keep doing this work? And I think I know it, right? You've shared so much about your personal story, but I know that there was possibly a passage that you were going to be willing to share with us. And so I'm really excited to kind of hear and really understand even more so the why, and you sharing it with others through this.
Absolutely. I know I will totally take a few minutes here to read an excerpt from the opening to my book, which really goes into the why. And, as I write in the opening, I'm not going to read this whole part, but I write about how, people often ask me, why I got into the science of learning and social emotional development, like why I do the work that I do, because full transparency, like I became a professional in this space before I became a parent on the other side of the table in the system. Like it was like the trajectory of that, and as I tell in the opening of the book, like I really do feel like it found me, like the field found me through a series of exchanges and events, and I'll kind of share the last one in that as just a little excerpt for you. But let me make this bigger because I have middle-aged eyes, and so let's do that. And I'm happy to share a little bit with you. So a few months later, I found myself starting a Ph.D. in applied developmental and educational psychology at Boston College and a certificate in human rights and international justice at BC Law. I was going to become a psychologist. I wanted to be the change I wanted to see in the world by doing research that evolved school policies and practices. So for the next 5 years, I deeply studied how the science of learning and social and emotional development could support all kids and communities to thrive. And while I learned all of the sophisticated stats and how to think like a prevention scientist in my coursework, my understanding expanded most through my experiences in schools with youth and educators who were all othered by the US education system. So I taught youth with emotional and behavioral challenges who were relegated to windowless basements in abandoned public school buildings taken over by the state, youth learning in correctional facilities, youth who were wardens of the state residential program, medically complex youth in and out of exclusionary public school places, and neurodivergent youth who had been banished to hallways and trailers on the outskirts of their neighborhood public schools. I saw the best of humanity in their educators and support staff, colliding with a never-ending sea of barriers to their students' joy. And all of these unfortunate experiences were laced with systemic prejudices. The systems designed to support the youth who had been positioned by society to be most in need of services and social support were undeniably broken. I asked anyone who would listen to me why, from school administrators, district leaders, mental health professionals, parents, advocates, teachers, specialists, families, and the students themselves. And the answer, it was always some version of, it's just the way things are. It's just the way we do things here. Now, these lessons I learned about how the system isn't working for those deemed by society, it came home for me when I became a mother. And seemingly overnight, I found myself on the receiving end of injustice masquerading as common practice, compliance, standard procedure, conventional wisdom as a checkbox. And the injustices, they just kept getting uglier with each interaction I had, no matter the grain size. The culture, it didn't discriminate, be it at our kitchen table, the local playground, on the sidelines during a recreational soccer game, or a national theme park. It didn't matter if we were at the doctor's office for a wellness check or riding in the back of an ambulance, again, en route to the emergency room. It was in their elementary school classrooms, around the table at the IEP meeting, at the school board meeting, at the university, and at the floor of the Senate. I heard it everywhere. It's just the way things are. It's just the way we do things here. And we're expected to be patient with it. So as it turned out, 2 decades later, I married that boy I had lunch with every other sixth period, and yes, he did use those I statements we learned from our peer mediation days when he proposed. We're building a beautifully full life together, having been granted the gift and ultimate charge of supporting our 4 exceptional children who are coming of age in an increasingly tiled world that is simultaneously wildly different yet eerily similar to the one that I grew up in. The leading cause of death among young people in the US right now are guns. 95% of students in the US experience active shooter drills at school, despite there being no credible evidence that they're effective. Culture wars and identity politics have been tearing apart homes and neighborhoods based on stereotypes, misinformation, bias. Our families are simultaneously more connected and more lonely. And while our kids are growing up alongside artificial intelligence, emotional intelligence is being banned from their classrooms. Issues of diversity, equity, inclusion frequenting the national headlines, laced with ableism and hate speech. It's as if every new technology and science, medicine, information, everyday convenience is on a head on collision with old ideas, bias, and ineffective solutions. I have been thinking about writing this book for a long time, but what pushed me to finally write it was when our middles, Salvatore and Eleanor, started asking questions. When Salvatore asked me why he had to hide for a drill at school, Eleanor asked why I call her neurodivergence a superpower, when a teacher told her disability is an illness, when they asked me why we had to wait for another bus to accommodate their older brother Miles and his wheelchair for all other families, they would get to go ahead. My children's questions, they inspired me to a new level of realization. Why are we being so patient in the face of injustice? What are we waiting for? So, to be sure, nearly everyone believes that patience is a virtue, and in fact, it is one of few principles of correctness that communities across ideological divides agree on. But there is a distance between being polite and being right. It's time to be unapologetically impatient in our pursuit of justice. I see this in my own life when navigating systems of education, healthcare, and industry that are not designed with my family and our needs nor best interest in mind. And you can see this every day in the quiet experiences of all families who are navigating perceived disadvantages from disability, language, income, culture, or education, and the discrimination they encounter on the regular. This book is my love letter for my children, family, our generation, for every person who's felt small and seen wrong. It's for care providers, makers, dreamers, doers, the educators, and the architects of a future that embraces our common humanity. It really may take our lifetimes to change how systems operate or even how you and I are seen in a system, but we can each harness the power in our positionality to interrupt the status quo right now. We can do it every day by prioritizing compassionate, empathetic inquiry. We can ask questions, just like my dad taught me the intention of calling each other in, not out. We can share expertise in the form of lived experience in real time to affect change. When our patience manifests as complacency with injustice, we are waiting for systems change at the expense of our families, and I am not waiting for justice at the expense of my children, and you don't need to either. It's time to be unapologetically impatient. Let me show you how.
We love that.
Thank
And
you
I
so much for
saw
letting
some
me share.
applause in the chat. Like, that was incredible, incredible. And if that's just an excerpt, imagine what those pages hold for so many
Thank you
of
so
us, for
much.
all of us. You don't have to be a parent to see the need for this work. And like you said, it can be in anything, in the workplace, in so many industries. We see things like this, difficult situations and changes, right, to the systems, and how that needs to happen. So awesome. So
Thank you
much
so
coming
much.
through the chat. That applause, I love that.
I just see
Well,
lots of little hands glowing and
I
things, which I really
know, like the
appreciate. So
the, the
thank you, because I'm
floating
talking
emoji
to
hand.
just you. You and I are having a conversation, so it's like kind of like forget that there's other people here. So
I
thank you all so
know, I
much.
know. It's so fun. It's so fun. Well, I wanna make the parallel, because some of the things that you've mentioned throughout our time together really emphasize some of the resources available through the Harmony curriculum. A lot of what you talked about is even so more so what we want to highlight and echo, that there's content and there are materials out there to help support this work, this passion, this calling in this working together as a group. And so I want to make sure I spotlight the Harmony curriculum. We have so much content and great resources to support the work in schools. We have things for out of school time for our after school time providers as well as in the schools. We offer no cost curriculum and find that we also include home to school connections. So families can continue to build those skills at home. These letters that we send home to families explain the realization of what social and emotional concepts that are being taught in the classroom, and offers even some practical suggestions on things that you can do at home. We provide actual physical kits that can go home to be with families and parents to help again develop and build those skills, with strategies on building healthy relationships at home. When those healthy relationships exist at home, it is more likely that when the child comes to the classroom, they'll understand how to navigate those relationships within the classroom as well. And so we wanted to make sure we highlight all of those pieces for you today. Additionally, we want to bring light to some educator professional learning. These are some of our what we call Harmony professional learning modules. This fosters that belonging and connection. Again, learning how to navigate those difficult changes and conversations, giving you more capacity, bringing modules together for you at no cost. There are over 80 different topics, from helping you to develop as an educator to your own well-being, right? And fueling what you need to show up every day as a strong advocate and educator. And so that is available to you as well. Please take advantage of these resources. And lastly, we are enthusiastically anticipating our Harmony at Home app. This is going to be coming this fall. It is dropping this fall. It's called Harmony at Home. It's going to be for parents and caregivers to build essential skills, promote well-being, and strengthen relationships on the go. We are some busy parents out here, and we know that having things right there at the palm of your hand on your cell phone is going to be what you need to address needs on the spot. We're so excited that that is going to be coming. I want to lean in because the conversation is so good. I want to lean in to some final thoughts from our guest author, if we can, and really just kind of get a feel of, are there any last words that you want to share? We would love to hear that. What do you have for us, Dr. Cipriano?
Well, first, so much gratitude to the many people who've signed in today to be here to join us for this conversation, and the opportunity to share my love letter with you all and kind of speak about this book that is deeply personal to me. And I really do hope will help to support our broader communities and country engage in kind of what this next stage of restoration and health has for all of us. I will double down in reminding you all that we each have power in our vantage point. So our positionality, our power, it's not a disadvantage, it's a different vantage point that each and every one of us have. And so I write from the lens of disability and the ways in which that has changed the way I see the world. And I invite each and every one of you to engage with these skills and strategies and recognize how your vantage point has the opportunity to affect change in your everyday lives as well. So thank you so much for the opportunity to share with you all
So
today.
good. Yes, yes, yes. And I just wanted to also let our viewers know that just for being here, you're going to be entered into a drawing. We're going to be giving away one of these books signed by Dr. Cipriano. So, thank you for being here. Thank you for taking that time. It was well worth it. This book is going to be launching very, very soon as the summer is almost upon us. And so we're really excited to be able to give away a signed copy. So That being said, we'd also like to extend our gratitude to our amazing Dr. Cipriano for spending the last 45 minutes hanging out with us and really pouring out so much of herself. We also thank each and every one of you. As mentioned earlier, you could have chosen to be anywhere. Some people, this is your lunch break. Some you're listening while working. Whatever that looks like for you, thank you. We recognize how busy everyone is, and to carve out this time to really engage is really beneficial. Be on the lookout for a survey that's going to come that will kind of ask for your feedback. We appreciate you sharing any feedback you can. We want to make these webinars better and improve as we go. And I believe that is all I have for you this afternoon. Much appreciation. It looks like the chat has several appreciative notes there. So thank you, everyone. You all have a wonderful afternoon, and we'll see you next time.